Assalamu alaikum wa rahmatullah. The article of this week is titled Effect of Photobiomodulation in Pain Following Single Visit Non-Surgical Root Canal Treatment of Molar Teeth with Symptomatic Irreversible Pulpitis. It was done by Iranian group in 2023. The aim of this study is to assess the effect of photobiomodulation on post-endodontic pain of mandibular molar teeth with symptomatic irreversible pulpitis. So, the post-endodontic pain is the most common complication of endodontic treatment, and nowadays, by the development of new laser systems that include fine flexible fibers, they can be used for different purposes in endodontic treatment, such as diagnosis, pulp capping, pulpotomy, disinfection, and control of post-operative pain and inflammation. The photobiomodulation therapy uses a low-level laser in the visible infrared or near-infrared spectrum with 600 to 1000 nanometers wavelength. It's commonly performed to induce tissue regeneration, decrease swelling and inflammation, and alleviate the pain with its photochemical effect and different irradiation times. So, for the materials and method, 90 patients, 45 females and 45 males between 20 to 50 years, they were selected and they were complaining of moderate to severe pain in their mandibular molar teeth, so the teeth with symptomatic irreversible pulpitis were included in the study. Then endodontic treatments were performed by the same operator, and after completion of the endodontic treatment, the patients were randomly divided into two groups of photobiomodulation therapy and placebo, which was performed by another operator. The two groups were standardized in terms of age, gender, type of the tooth, root curvature, and severity of pain before the treatment. In the PPM group, a low-level diode laser with 940 nanometers wavelength, 200 megawatt output power, and a glass fiber tip with 400 micrometer diameter in continuous wave mode was used. The laser was irradiated to the buccal and lingual surfaces of the root of the mandibular molar at the level of the apex for 30 seconds. The fiber tip of the laser, it was positioned perpendicular to the surface and close to the soft tissue. And for the placebo group, the fiber tip of the laser was positioned over the buccal and lingual surface of the tooth at the level of the apex, but no irradiation was performed. The patients reported the level of pain experienced at 6, 12, 24, 48, and 72 hours post-operatively using a visual analog scale, and then data were analyzed. Moving on to the results, of all 44 patients were female and 46 patients were male. The difference in gender distribution was not significant between the two groups, and no significant difference was noted between the two groups in terms of age or preoperative pain. And as you see here, this graph, it shows a comparison of the mean pain score in laser and placebo groups at various intervals, where dashed line represents the placebo and the continuous line represents the laser. Both groups reported significantly lower level of pain after treatment compared with their preoperative pain score. Also, as you see, the post-endodontic pain at all time points was significantly lower in the PPM group compared with the placebo. And here is another graph that compares the frequency of pain scores in the PPM and placebo groups. The results showed significant differences in pain scores between the two groups at 6, 12, and 24 hours post-operatively. Whereas in the pain score in the PPM group was significantly lower than that in the placebo group. However, this difference was not significant at 48 hours and 72 hours post-operatively. Moving on to this table, which compares the mean pain score in males and females in the two groups. As you see, the results showed that females experienced significantly lower mean pain scores than the placebo at 12 and 24 hours. However, this difference was not significant at 6, 48, and 72 hours. The mean pain score in males in the PPM group was significantly lower than that of males in the placebo group at all time points. In conclusion, the photobiomodulation can be used for pain control after primary endodontic treatment of mandibular molars with symptomatic irreversible pulpitis.